I wrote this book because many people, both clients and instructors, come to me needing information about various spine and joint issues and how to integrate that information into their lives and professional practices. Many people who are told that they have something wrong with them do not fully understand what this means to them in terms of movement and lifestyle. I have seen time and time again people who have been referred to yoga, Pilates, or personal fitness trainers by their doctors without specificity as to what type of yoga, Pilates, or fitness they are recommending. This leads to confusion because, depending on the issue each person faces, there are different movements that are advisable or not for each condition, and there are different types of training and experience amongst the populations of yoga, Pilates, and other movement professionals. This book seeks to bridge that informational gap and provide both movement teachers and people healing from or living with spinal pathologies or joint issues a way to understand what they are dealing with and how they can move safely, both to prevent further injury and to heal. A central tenet of my practice and belief is that each person needs to be educated and empowered to move safely and effectively within the body structure that they have. I believe that helping people understand the meaning behind the medical terminology is the first step. The second step is teaching the movement patterns that need to be emphasized, de-emphasized, or eliminated, so people are educated and empowered to be primarily responsible for their own bodies. Many of my clients report that they are actually in a position to teach their other teachers how to work with them after working with me. This happens because they are now able to customize yoga poses and other exercises for themselves, and teachers are curious, so they ask questions. This means that the individual, once educated to understand exactly what their diagnosis means or the implications of their post-surgical, post-rehabilitative body, can learn to move safely and effectively no matter what the environment. So, whether it is their activities of daily living, yoga, Pilates, or general fitness, they will be better prepared. The movement parameters can be transferred from a situational information base to a more global information base that can be translated to different circumstances. Similarly, the more educated instructors are about the possible ailments affecting their clients, the better they can ensure safe movement for their clients. They can create variations, steer away from or recommend specific exercises, encourage clients to try a different program, or collaborate with allied professionals as needed. Teachers who have completed my training programs are able to work with special populations far beyond the scope of a standard teacher training or continuing education course. I like to say that I teach them to fish. In other words, to think on their own, beyond the limitations of specific variations for specific poses or exercises in specific situations, to more global parameters that can be translated to any variety of movements and exercises. My goal is to offer this book as a tool to help teachers and their clients who have impacted spines and hips learn problem-solving methods and skills to use in their studios, clinics, or home practices. If someone has painful symptoms